Hi friends, good evening and welcome to my channel Mukambika Nursing. Here in this video we can see some important points and tips for the exam as well as for your interviews. Okay, we will see the important terms and important points. First we can see medical syndromes. In that first one, Adam-Stroke syndrome. This Adam-Stroke syndrome is an episodic cardiac arrest and syncope due to failure of pacemaker. Okay, due to the failure of pacemaker, there is an frequent cardiac arrest and syncope means fainting occurs to the patient. That is known as Adam-Stroke syndrome. Okay, and the next point, Tachybrady syndrome. This tachybrady syndrome is a clinical manifestation of sick sinus syndrome and is characterized by alternating period of bradycardia and tachycardia. That is bradycardia, tachycardia. Brady-tachy syndrome is a clinical manifestation of sick sinus syndrome. Sick sinus syndrome means one of the heart rhythm disorder. Heart rhythm disorder. Okay, characterized by alternating, that is different, alternating, once bradycardia then tachycardia. Bradycardia means decreased heart rate and tachycardia means increased heart rate. Okay, so bradycardia followed by tachycardia, that is known as brady-tachy syndrome. Next is blue toe syndrome. This blue toe syndrome is a skin necrosis and ischemic gangrene manifest as blue color of toe, resulting from arterial occlusion usually caused by emboli, thrombi or injury. Due to any injury or due to the formation of thrombi or emboli in the arteries which may result in blue color of the toe, that is known as blue toe syndrome. Battered child syndrome. This battered child syndrome is a multiple traumatic lesions of the bone and soft tissues of children, often accompanied by subdural hematoma. This battered child syndrome is one of the multiple traumatic, that is different, multiple means more than one, traumatic lesions of the bone and soft tissues in children. Okay, that is battered child syndrome. Next one, Apert syndrome. This Apert syndrome is an autosomal dominant disorder characterized by acrocephaly and syndactyl. This Apert syndrome is one of the genetic disorder, that is autosomal dominant disorder characterized by acrocephaly. Acrocephaly means congenital anomaly of the skull, that is top of the skull become cone shape, that is known as acrocephaly, and syndactyl means we know that is fused finger. This is known as Apert syndrome. It's one of the autosomal dominant disorder. Next topic is ECG changes in electrolyte imbalance. Electrolytes means our body contains sodium, potassium, calcium, magnesium, phosphorus. All those are the electrolytes in the body. So if it is varies, that is increased or decreased, that may affect the cardiac system. So ECG changes occurs in the body, that we can see here. First is hyperkalemia. Hyperkalemia means there is an increased serum potassium level, that is hyperkalemia. So in hyperkalemia we can see the ECG variation is tall peaked T waves, flat P waves, tall peaked T waves, okay, flat P waves, widened QRS complex and prolonged PR interval. These things we can see in hyperkalemia. In hypokalemia, hypokalemia means decreased serum potassium level, that is hypokalemia. So in hypokalemia, ST depression, ST wave depression, shallow, flat or inverted T wave and also prominent U wave. These are all the ECG changes in hypokalemia. Next is hypocalcemia. Hypocalcemia means decreased calcium level. Okay, so that is prolonged ST interval and prolonged QT interval in hypocalcemia, and hypercalcemia may exhibit shortened ST segment and widened T wave. Okay, hypocalcemia and hypercalcemia. Next is hypomagnesemia and hypermagnesemia. Hypomagnesemia means decreased serum magnesium level. In that we can see tall T wave and depressed ST interval. And hypermagnesemia exhibit prolonged PR interval and widened QRS complex. This hypercalcemia may also exhibit this widened QRS complex and prolonged PR interval. Same in hypermagnesemia. And next we can see some important related serum electrolyte normal values. In that first we can see normal serum sodium level, that is 135 to 145 milli equivalent per liter. And normal serum potassium level is 3.5 to 5.1 milli equivalent per liter. And normal serum calcium level is 8.6 to 10 milligram per deciliter. Normal serum calcium level. And next is normal serum magnesium level, that is 1.6 to 2.6 milligram per deciliter. And normal serum phosphorus level is 2.7 to 4.5 milligram per deciliter. Okay. And the next topic, normal arterial blood gas analysis values. We can see pH of the blood is 7.35 to 7.45 and partial pressure of carbon dioxide is 35 to 45 mmHg and bicarbonate is 22 to 27 milli equivalent per liter and partial pressure of oxygen is 80 to 100 mmHg and oxygen saturation is 96 to 100%. This is the normal arterial blood gas values. Next one is normal venous values. We can see, that is previous we saw arterial values, this is venous values. In that pH of the blood is 7.35 to 7.45 and partial pressure of carbon dioxide is 41 to 51 mmHg and bicarbonate is here 22 to 29 milli equivalent per liter and partial pressure of oxygen in venous blood is 30 to 40 mmHg. This is important. And oxygen saturation of venous blood is 60 to 85%. In arterial blood it is 85 to 100%. Here it is 60 to 85%.